When it comes to budget cuts, health spending is in a high-risk category, and the HSE is already in trouble. By year-end, its expected deficit is 300 million. It's already in the red. Under pressure and under threat of abolition, it's now accused of making crude cuts that affect its most elderly, vulnerable patients. This year's health budget was over €13 billion, but despite cuts and HSE savings, demand for services grew.
They have a fairly large deficit, maybe as much as 300 million, which has to be brought forward into next year. And if that doesn't come out of healthcare spending, it'll come out of social welfare spending, it'll come out of education spending, it'll come out of something else.
In the last fortnight, the HSE region with the biggest deficit announced the phased closure of 3 nursing homes. Affected communities are on the march. Last Sunday in Abbeyleix, a rallying point for thousands, throwing down the gauntlet to nervous TDs.
This is only the start. And if we don't get our way, we will start a national movement. And it'll be worse than the medical card one, I'll tell you that.
Patients too are active. 3 residents of the Abbeyleix unit launched a legal challenge to the HSE decision. It is ongoing. The Dublin Mid-Leinster region has the highest deficit. The latest figures, by September, a community services overspend of almost 7 million. Total deficit 61 million. The HSE fix, the phased closure of community care units in Abbeyleix and Shane just outside Portlaoise, and Crooksling Nursing Home in South Dublin, as well as bed closures in Athy. At least 150, mainly elderly patients already affected.
In less than 2 weeks, 2 announcements of 2 hospital closures in Laois. It's an absolute shameful disgrace.
The HSE is wrong in making this decision. I want to invite the Action Committee and the public representatives to meet with Dr. James Riley on Wednesday next. We'll sit around the table and we'll sort this out.
The day before that meeting, the news got worse. Minister James Riley told the Joint Health Committee up to 40 nursing homes could close next year. So far, 35 units are earmarked for closure or bed closures as part of a HSE review into their cost and viability. Overall next year, more than 800 bed closures. The following evening, Wednesday, the Laois Offaly group met the minister.
Well, he did say that obviously within the region there are broader issues, and yes, Shane would be in the mix.
One campaigner to save St Brigids Hospital Shane is local Fine Gael councillor Willie Aird. He was angry at a public meeting the following night.
Shane Hospital was opened as a sanatorium, and this country was in a far worse state of economy at that stage. There was very little money in the country, little or none. And we were able to do that, and the patients were being able to mind it.
Reporting back from their meeting with the minister, public representatives said he suggested nursing home patients could not be moved without 6 months' notice being given.
I do not want to have it closed, and this thing is telling you that you get a 6 month stay on it. 6 months is only like a day to all people.
The HSE has pointed to 3 reasons for the closures: money, the moratorium on recruitment in the public sector, and existing or future HIQA nursing home standards. Crooksling is one of the nursing homes set for closure. The HSE wants to transfer the majority of its patients to a purpose-built unit ready to go in Inchicore. But relatives say it's inappropriate.
For a start, it's 2-storey, which is ridiculous for the type of resident going to be moved. It's right behind a block of houses, right up to the back walls almost. It's like a big warehouse. The entrance is like big factory gates. It's just a general wasteland. There are lots of people living down there in a perfectly good area, but it is not the place for a nursing home.
It's not just patients who are concerned.
St Brigids was an absolutely delightful place to work. The patients were happy, the staff were very happy. It was a lovely setting. And the patients enjoyed that setting. And expecting them to readjust to a new setting, and particularly maybe a less than pleasant setting, would be traumatic for them. They don't even like being moved from ward to ward. particularly.
The HSE spent $2 million on care services at Crooksling 2 years ago. It says several million more would be needed to bring it up to standard and meet new ones in 2015.
My experience would say that it is not safe to move these patients. There is evidence from elsewhere, and I've seen it myself, that if you move these type of patients, they don't survive very long.
But the HSE told Primetime that there was no conclusive evidence that that is the case. It said evidence did exist that any risk can be minimised through a comprehensive professional transfer programme. It said the timescale for the closure of Crooksling is 3 to 6 months, and to date discussions have taken place with most families, discussions which would be ongoing. The move to close nursing homes is being criticised for removing one of the very things the system needs, step-down facilities. For one face in last Sunday's crowd, the problem is acute. Dr. John Madden is a local GP in Laois.
Since the 5th of October, all the GPs in Laois have had 4 separate emails on 4 separate occasions advising us that we should not refer patients to our local acute general hospital in Portlaoise. The reason for the overcrowding in the hospital was because they were unable to admit patients from the A&E department to the general hospital wards. And the reason that they cannot admit people to the general hospital wards is because there are patients in the general hospital wards who need to be stepped down to nursing care facilities.
For example, an email on the 5th of October warned doctors in Laois Offaly that Portlaoise Regional was seriously overcrowded. It said there were 25 patients on trolleys, an unprecedented number, compounded by 17 delayed discharges. And it went on, the situation remains unchanged. Therefore, please do not refer patients to Portlaoise until further notice. Irene Fitzpatrick, another face in the crowd, has direct experience of waiting for a step-down bed. Her 86-year-old dad Joe is a patient of John Madden, and he was what's called a bed blocker. On the 13th of August, Joe was admitted to the emergency department in Portlaoise with suspected heart trouble.
He was put on monitors and there was tests and everything done to see what was the problem. So they said that he had pneumonia and pleurisy, and he was very unwell.
Joe did not need coronary care, but for another 10 weeks he waited in wards, first for home help, then for the Fair Deal nursing home scheme.
He needed 24/7 care, and that it wasn't going to be available at home. We did try to get home help at home, but it wasn't a success.
We have 85 people in Laois Offaly at the moment on home care package waiting lists. These are not being processed. 4 of those patients are currently in hospital.
We were waiting for this Fair Deal to come through, and he was there until the 1st of November. And on the Thursday previous to that, I got a phone call to say that the Fair Deal had come through and there was a bed available for him in whatever nursing home we chose.
When Joe was discharged on the 1st of November to the nursing home, I received a letter from the consultant in charge of his case who advised me that Joe, although he was in hospital for a 10-week period, in fact needed 7 days of medical care. The other 9 weeks were taken up with looking for step-down care. Home care packaging costs of the order of €200 to €300 per week, as opposed to private nursing home care, which of the order of €700 to €900 per week, as opposed to district hospital care, which of the order of €1,400 per week. And finally, the cost of Portlaoise or acute general hospital care is of the order of €1,000 per day.
The hospital, the A&E department, they're terrible places to receive most healthcare. Most healthcare should be delivered in the community.
While the HSE is fighting a battle for survival, it's losing the argument with both the public and their local representatives.
The tactic at the minute being orchestrated by the HSE is to, first of all, they run down the hospital. Then they wind it down, and then they tell you it's unsafe, so they have to close it down.
Part of the savings the HSE hopes to make from the cuts is on the rapidly rising costs of agency workers.
They're attempting to close Shane so the nurses in that area and other staff can be transferred to Portlaoise and Mountmellick's to reduce the agency bills in those areas.
Agency workers, from nurses to porters to medics, will cost the HSE $200 million this year, a figure that outstrips the target of $187 million it will save in the same period from the moratorium on staff recruitment.
They want to be directly employed. This is not a career choice to work for an agency. Many of them have been trained by the HSE and have graduated and are now being told, we've trained you, there is work for you, but we're not going to employ you. We're going to pay an agency an additional loading and then bring you in to work on our services.
HSE figures show that despite cuts in pay rates, agency staff costs are still at least a third more than directly employed workers. But they do provide flexibility, not least in HSE accounts. Agency costs appear separately from directly employed staff costs. And in the mission to keep staff costs and numbers down, to keep finance and the IMF, ECB happy, that counts for something.
The HSE doesn't wish to be the employer in this instance. They admit to us that doesn't make any financial sense in the short term or in the long term. This is about controlling numbers.
Their system of management is not efficient. It's very hard to say how inefficient because they haven't got a financial system that allows you to answer that question. They've still got 11 financial systems, which of course is a legacy of the health board days.
But for the public affected by this accounting, there is no relief.
Please just pump the money in to finish off this wonderful facility. It's heaven here for the people, and if it's not broken, why fix it?